Bismillahirrahmanirrahim. Our topic is antenatal care. Antenatal care is the care that is given to expected mother from the time when the conception has been confirmed until the time of delivery. Now, this care is oriented between the doctor as well as the pregnant mother. The main aims of this care is to prevent, detect, as well as manage those factors that can adversely affect the health of the mother as well as the baby. Now, the doctor role is to provide with advice, reassurance, education, as well as support for the mother and her family, and to deal with minor ailments of the pregnancy, and to provide general health screening in order to overcome any further complications that could lead to miscarriage. With the help of a schedule in which medical checkup is done every 4 weeks up to 28 weeks of gestation, and then every 2 weeks until 36 weeks of gestation, after that every week until the time of delivery. So the normal span of antenatal care or antenatal visit should be across 7 to 11, but these visits can increase if a complication is suspected. Now, we start antenatal care with booking visit. The booking visit has 6 points. The first point is the confirmation of the pregnancy. Then we need to date the pregnancy, that how long the pregnancy has progressed, and we need to calculate the expected date of delivery, dating ultrasound in those women who are unsure of their last menstrual period or unsure of for how long they have been amenorrheic, and lastly we do an examination as well as investigation. So that was a handful, so our journey begins now. First point, the first thing we need to do is confirm that the female is pregnant or not. This is done by 2 tests: urine examination and serum examination. And urine examination, whenever female pees on that specific stick, now it can be the positive and can be negative. The positive is elicited by 2 bands on that test. So if 2 bands are seen, that means it's positive, and if 1 is seen, it is negative. Now, how does it convert into 2 band or 1 band? This is due to the presence of human chorionic gonadotropin that is secreted both in urine and maternal serum. Now, this hormone is secreted by the placental tissue known as the trophoblastic tissue. Along that, the female have particular symptoms such as nausea, increased urinary frequency, amenorrhea for quite some time, or missing her last menstrual period, or it has been prolonged for quite some time, and symptoms like breast tenderness. Now, if all of these are present, these are not clearly defined to a pregnant woman. Sometimes these are not even present in such a female. But if she has such symptoms and you do ultrasound after 12 weeks, you can see a fetal heart. Now, the next thing is, after you have confirmed that the female is pregnant, you have to date the pregnancy, calculate that how much time has progressed. This is calculated by asking her for the first day of her last menstrual period, and if she doesn't know, we can do an ultrasound. But ultrasound is diagnostic in 10 to 14th week of pregnancy. So the next thing is, we need to calculate expected date of delivery. Now, after you know that she has been last menstrual period was on this date, so on that date you have to only add 9 months and 7 days. By doing this, you can get an expected date of delivery. So a common example is for supposedly if your last menstrual period is 19 Feb, so to the month Feb you add 9 months. So if you add 9 months to that, Feb, March, April, May, June, July, August, September, October, November. So upon adding 9 months, you get a November, and then we add to the date 7 days more. So 19 plus 7 is 25. So her expected date of delivery would be 25 November. Congratulations, ma'am. And some people who don't know their accurate date, now what we do is we do a dating scan that is done across 10 to 14th week, and the use of the scan is in those women who have poor cycle regulation. This also helps to reduce incidence of induction of labor, that if supposedly you have gotten the wrong last menstrual period and you assume that the female is 40 weeks pregnant and you want to induce labor in that female, that would be very wrong if that baby is premature and the data that you have received is wrong. So dating ultrasound helps such problems. It can also help to detect fetal abnormalities. It can early detect multiple pregnancy and determination of failed but asymptomatic uterine pregnancy. Now we go towards some parameters in which can help us to assess fetal size. This can be done now. Few biophasic parameters include the crown rump length. Now in this, what we do is we measure length in millimeters from the head or the crown up to the buttocks, or also known as the rump. This is commonly done in across 13 weeks plus 7 days. This is an ultrasound showing calculation of crown rump length. Then another biometric parameter is head circumference. This is important because it tells us how well the brain is growing. Now this is done across 14th to 16th week. Now when we calculate all of these parameters, we can also know fetal weight. This fetal weight is calculated by adding head circumference to biparietal diameter, which is also the head one, and abdominal circumference addition to femur length. And the fifth parameter is the booking history. This history includes gynecological history, which includes again last menstrual period, her period, frequency, cycle, regulation, etc. And then previous obstetric history, or any family history that could, or any current medical history that she is having. This is also need to be known in the booking history in order to overcome any complications or any problems that can affect the fetus or the maternal health. Then last we do is a booking examination. This normal parameters are followed, such as blood pressure, doing an abdominal examination, calculating the BMI, urine test for protein, glucose, leukocytosis, nitrates, and even blood. Now, why do we need to assess blood pressure? If the female has such medical problems, this problem needs to be overcome for prevention of complications such as preeclampsia and eclampsia, in which the blood pressure is quite high, which can affect the fetal life and result in basically miscarriages and even fits in the mother. So we need to overcome such problems. Then we go towards abdominal examination. This includes measurement of the fundal height, assessment of the fetal lie. Fetal lie is a parameter in which fetal axis versus the maternal axis. Presentation is defined as what presenting part is present in the pelvis at that time. And further abdominalization also helps us in assessment of fetal movements, auscultation of the fetal hearts, inspection of scars, and other relevant abdominal findings. Now, abdominal examination helps to monitor progression of the pregnancy as well as fetal growth, helps us to assess fetal lie, presentation, and etc. And now, the first thing, whenever we palpate the abdomen of the pregnant female, we use the help of an ulnar border, that is curved left hand on the woman's abdomen parallel to the symphysis pubis. We start from the xiphi sternum and gradually progress downwards to the symphysis pubis, lifting the hand between each step until the bulge resistance is felt. That resistance is basically uterine fundus. Now we mark the fundus level up to the symphysis pubis. That is actually the weeks that the baby has progressed. So if we are calculating, if you feel the fundus at this point above the umbilicus, if you feel it at the umbilicus level, for sure it is between the weeks are between 20 to 22 weeks, and if it is 2 finger breadth above that, then it can be 24 week. If 2 finger above that level is 28 week, 6 fingers 32, and 8 is 36 weeks. The fingers at the pelvis, if you feel the head, then that is normal presentation, and if you don't feel the head, that is basically breech presentation. So it helps the which type of delivery should we plan in such a patient, or this patient needs excess phallic version of not. Lastly, what we do is we calculate the mother's BMI. That is essential because if the female is present towards low BMI, that is less than 18, this could result in decrease in nutrition in her body, that could result in fetal growth restriction. If the female has high BMI, that is more than 35, and she is very obese, so this can point out towards gestational diabetes, in which the female during her pregnancy gets diabetic. It can also result in preeclampsia, and emergency C-sections could result in anesthetic difficulty. Now lastly, our 7th point is the booking investigation, which we do a normal protocol. In CPC, we measure the hemoglobin levels. If she has iron, by this we can overcome iron deficiency and folate or folic acid deficiency or cobalamin deficiency. Then we do blood grouping in order to know if the mother is Rh negative and the baby is Rh positive. This can result in serious complications such as known as erythroblastosis fetalis. So in order to overcome such problem, we give the anti-D antibody at the 28th week or after 72 hours, within 72 hours of delivery, in order to prevent sensitization of the mother, which can help in subsequent pregnancies. Now next we do is urine analysis to rule out infection, protein and glucose. We do rubella screening because this is the most dangerous virus which can affect the fetus and result in grievous outcomes. So we immunize the patient, and the patient is also the mother is also advised to not to get pregnant for at least 3 months after receiving such vaccine. Now we do a hepatitis screening because as the baby, if the mother has active hepatitis, the baby becomes a carrier, and so she needs to be actively immunized by a vaccine. And mother with active disease should at least receive HB immunization. We also need to rule out HIV mothers. If some female who's screen are positive, we start antiretroviral agents, and we should plan an elective C-section and avoid breastfeeding in order to prevent transmission to the fetus. We also do syphilis screening in positive mothers, and we start the baby on antibiotics in order to prevent baby's malformations. We do HB studies in order to rule out thalassemia and sickle cell anemia. And lastly, we screen the vagina for group 3 streptococcus, which can cause ascending infections and can result in chorioamnionitis. Now, screening of fetal abnormalities is also common. We can do this by ultrasound. Now, we can detect Down syndrome by checking for nuchal translucency. Now this is checked at the 11th week, and we can also do a biochemical profile at 15 to 20 weeks, which is checking for alpha fetoproteins in the blood. Now normal nuchal translucency is between 2.9 millimeters to 3.5. Now this is an area between the fetal head and the amniotic cavity. Now this should be normally between 2.9 millimeters to 3.5, but if it is thickness is more, this is considered abnormal. Now this can also help us detect cardiovascular abnormalities in the fetus, altered extracellular matrix composition, as well as limited lymphatic drainage. Now screening for neural tube defects is also very important because vitamin B9 deficiency is quite common. This can result in spina bifida and encephaly like problems. So screening should be done between 8 to 20 weeks, and we need to quickly overcome this problem. So hence in the first trimester we advise the female to take lots of vitamins in order to prevent such thing. And this can also be assessed by checking crown rump length before 20th weeks by ultrasound, and after 20 weeks by symphysia fundal height. If it is not between that range, so that means some sort of defect has been present. We got just pregnant.